business, but in many respects, there have been, additional costs and operational considerations that, that our clients need to take into consideration. So, Jim, what are some of those factors that you've seen?
Yeah, thank you, Ryan. There's a couple. I think first is just, of course, increased expenses like personal protection equipment, PPE, and that's for providers whether you're in the home, like autism, home health, or you're in a facility like physical therapy, many physician practices. That for your healthcare providers, that's an additional cost these days that obviously never had to be factored in before. A second one is just really the care delivery model, particularly for the facility-based and in-office providers. You're not going to, because of social distancing requirements, because of sanitation requirements between visits, you're simply, at least right now, not going to be able to achieve that pre-COVID level throughput that you did through your facility or your office because of those constraints, again, due to social distancing. And of course, additional costs for sanitation. So that's one thing, or another thing to consider. Another factor that's played in is telemedicine. Telemedicine has both pros and cons. Pretty immediately in late March and April, you saw payers approve telemedicine visits for certain subsegments of healthcare that they had never approved before, and they did it rapidly. And that, for many, many providers, was a lifeline, being able to switch to telemedicine visits. That helped support their volume, so that was a huge plus. I think when you think of telemedicine on the negative side, is there's only so much you can do in a telemedicine visit. For example, level 4, level 5 type of visits, you need to be in office, at least on the primary care side, to be able to execute those. Those are higher acuity visits, level 4, level 5, to be able to perform them, be able to bill for them. And so there are certain things you simply cannot do via telemedicine. So you saw many providers use telemedicine to stabilize volumes. However, their revenue per hour, revenue per visit went down meaningfully.
Thanks, Jim. And assuming that you're capable of getting comfortable with the numbers, and it just is so important, critically important to dig into all of these varying factors that can change performance. I mean, the practical element then comes down to in healthcare providers is getting that provider alignment. What strategies, Jim, have you seen used to ensure that providers are aligned in the context of a distressed transaction?
Yeah, thank you, Ryan. I think it depends on what type of provider you're trying to sell or raise capital for. Somewhat like home health, like physical therapy, again, autism, whether they're clinic-based or in-home, those are spread out among hundreds or maybe thousands of providers. So you don't have revenue concentration within the provider set. Now, you may want to, of course, incentivize the owner, former owner, executives that are running the businesses. But where we really see this in getting provider alignment is in physician practices, where maybe 5, 10, or 15 of the physicians really control or generate, I should say, a majority of the revenue. In those instances, it's very important that the buyers will require that the providers, who's probably equity, if we're talking about a private equity transaction, while they got liquidity in the first transaction, many physician practices end up the owners or physicians still own 35, 40, 45% of that business. That equity's underwater. And so you're going to want, any buyer's going to require that those providers, those physician providers, are incentivized in a new transaction going forward. And you have to do that in a compliant way, but you can do that via transaction bonuses, co-investment, equity incentive programs going forward. Again, very important when you only have maybe 5, 10, 15 doctors generating all the revenue, that they're on board with the transaction. They're not going to be happy, right, because their equity's underwater. But I think we sell them as like, okay, a new buyer, a new day, a new opportunity to generate equity returns.
And one thing I would add, likely a very opportunistic and low valuation at which to attach going forward. So
Yeah, great point, Joe.
A good way to kind of cost basis, level set the valuation going forward.